Alright, so I've seen in my physician's orders that I have ordered to change my wound with my patient, so I am going to grab all of my supplies and head to my bedside. So then, once I've entered my bedside, I'm going to perform hand hygiene, introduce myself, say hello, my name is Cam Farron, I'm your student nurse, and I'm going to be changing your wound dressing today. Once they've agreed to the procedure, I can go ahead and provide them with analgesia, and once that's done, I can tell them to just bear with me for a second as I prepare all my supplies. So I'm going to start off by opening my kit. Keep in mind only touching the 1-inch borders. And then once this is open, I can go ahead and get everything set up and add everything to my tray. So I won't need this for this procedure. And grab my garbage bag. And place that anywhere that's convenient for me. And then grab all my stuff out. Grab my normal saline. Okay, and once I've added everything to my sterile tray, I can go ahead and don some clean gloves and assess my wound so I can remove the old dressing. I note a moderate amount of purulent drainage, or serosanguinous drainage, sorry, and then I can see that there is no odor to the wound. And then I just take note of all the peri-wound just for my documentation later. And once I have removed all that dressing, I can go ahead and don my sterile gloves. They just ripped. Okay, if they ripped, then in a clinical setting, I would grab a new set of sterile gloves. Now I can readjust. Now I'm safe to touch everything in my tray. I can go ahead and throw this out. So I'm just going to throw this back in the center here. And then I can go ahead and grab some water. Then I'm just going to irrigate the wound, making sure that I'm getting everywhere. Then I can throw my syringe out once that's done. And then I'm going to grab a 4x4 to dry the wound. Ensuring not to touch it, but I can just leave it in here just to soak up all the excess drainage. And then I can throw that out. And then I'm going to start cleaning my wound. So I'm going to grab my forceps, gauze pad. And I'll be using 2x2s, cleaning from clean to dirty. Clean to dirty. Clean to dirty. Now I can go ahead and dry it. clean to dirty always. There, and then once it is clean, I can go ahead and start taking measurements. So I'm going to grab my Q-tips here, and I'm going to measure the length is going to be, or the width is going to be about 9.5 centimeters. The length, 5.5 centimeters. The depth is about 2.5. Then this one's garbage because I've touched the wound now. And then I can see that I have some tunneling at the 7 o'clock. That goes about 2 centimeters. Now once I've took note of all that, that's what I'll be documenting later in my IPN, and I can go ahead and start packing it. So I'm going to just bring out my sterile gauze just a little bit here and prep it. I can grab a Q-tip here and start lightly packing the wound. Making sure that I am getting in all the tunneling or undermining areas if there are. And the gauze is okay to touch the peri-wound skin as it's clean, and I'm going to go till it is flush and not above the level of the skin. And then once it is perfectly flush with the level of the skin, I go ahead and throw this out and grab my scissors and cut the acrylics, except in this demonstration I'll not be cutting this because it's my practice. And then once that's done, I can go ahead and grab 2 4x4s to cover over. And then now once I've placed these, my gloves no longer need to be sterile, so I can go ahead and grab my abdominal pad and place that right over. And then grab my tape and start taping it down. Erica.
Oops.
Now it would tape down a little better if it wasn't Play-Doh. And then I'm going to document all my assessment findings that I found throughout the procedure in the IPNs, and that's the conclusion.